If you want to learn why specializing in your first 3 years of practice is a mistake, you gotta watch this. Why I thought this episode would be so great is this seems to be a question that comes up all the time with the new graduates that I tend to work with, whether it's in the Maximize Your Clinic program and the Next Level program, just in groups that I'm paying attention to. There seems to be this need or this urgency, which I completely understand from new graduates, to niche down, to figure out exactly how their practice is supposed to work, to have all of the pieces in line right away as soon as you graduate. And I just want to be one of the first to tell you that I am completely pitching this whole idea of identifying your unique avatar or your ideal patient avatar right as soon as you graduate. In fact, I think that that is sort of like the second thing that you should be doing after you've gotten at least 1 or 2 years of experience under your belt. I believe that the old school way of thinking about how we should be approaching our business when we graduate is always step 1, figure out where you want to practice. Step 2, create your ideal patient avatar. While I believe that there is some merit to that, I don't think we need to be niching down right away as soon as we graduate, nor do I think we should be spending a ton of time writing down and figuring out who Jane Doe patient is going to be that is going to dictate the way the rest of our business unfolds. I just don't think that that is the best use of your time. In fact, what I believe you should be doing as soon as you graduate is commit to see as many patients as you can in as short a period as you can. What this means is if you can be a part of 2 or 3 clinics instead of 1 to give you different demographics that you're going to be attracted to. In each of those practices, you will be surrounded by different practitioners, or if you're by yourself, again, it could just be different patients you're attracting. But hopefully you'll also be in places where you will have different mentorship, different networking opportunities. So when I first started, I started out in Caledonia and then Oakville. Oakville is a 40-minute drive away. So there's very little chance that there was going to be overlap. And I did that strategically because when I graduated, I said, I want to see as many patients as I possibly can in as short a period as I can to figure out how I am as a practitioner and who it is that I'm attracting. So this whole idea of needing to niche down your practice right away, I just don't necessarily agree with. And I find that the people that are giving you the advice to niche down your practice are also coming from a place where they started off generalized. And then when they decided to niche down, it of course opened up the floodgates and made their life so much easier. And I agree to that statement. But usually the people that are telling you that niching is the best thing to be doing didn't start out that way. They didn't graduate right from school and then jump right into a niche down practice. If they did, then I encourage you to ask the questions of where did you get that level of experience? Where did you get your mentorship from? Who did you study under to get that level of confidence where you could start with a niche? Most people don't have that unless it's been something you've been reading about, learning about, researching on, practicing when you were a student. The majority of us just don't have that level of expertise when we graduate. So I want to do this podcast episode to kind of take the pressure off of those people who are just starting out. You're just trying to figure out what it is that you want to do. Now,